The Scottish Cot Deaf Trust is the only cot deaf charity in Scotland. For the last 32 years, they have been tirelessly raising funds for research, educating the public and healthcare professionals, and supporting bereaved family members. We spoke with their Executive Director, Lynsay Allan, to find out more about their amazing work.
The Scottish Cot Deaf Trust was formed in 1985, so we're over 30 years old. We're Scotland's only charity dedicated to sudden unexpected death in infancy, sometimes called SUDI, and cot death is the very traditional term for that, when a baby dies suddenly and unexpectedly. The charity is based in Glasgow, but we do cover the whole of Scotland. A large part of the work we do, we support families who've been bereaved by the sudden unexpected death of their child. Now, the name might lead you to believe it is only very young babies, and it's only babies that have died in cots. It's not. The charity supports families who've lost a baby or a young child up to sort of preschool age, when that death has been sudden and unexpected. So we support parents of those children. We support other family members who've been affected by the death, including siblings. We also support professionals. If you can imagine a GP or a health visitor that's been practicing for 20, 30 years, and this is the first time that they're supporting a family, quite often those professionals need quite a bit of guidance and support in how they can help the family as best they can. And they themselves are very often quite badly affected by the death of this child, so we support professionals as well. The charity has three main aims, and I think something that I'm proud of is the fact these aims haven't changed since the charity was first founded. Now, of course, we support families and people affected by the sudden death of a baby. We also provide education, which is free to any professional, to parents, to the general public. And the education is really around the ways that cot death can be reduced. There are some risks that we know increase a baby's chance of dying from cot death, and our messages are, if there's anything we can do to reduce these risks, we need to share those as widely as we can. There's some very simple measures that people can take around making sure babies sleep in a safe environment. There's key things about position that babies are in. I don't know if you're aware of the Back to Sleep campaign from the early 90s. That was a very powerful public health message that really got out into the public domain, and that's been responsible for a huge reduction of cot deaths, about 70% reduction in cot deaths, not just in Scotland and the UK but worldwide. But we've stubbornly stuck with the plateau of this other 30%. And what we believe is that the position babies sleep in, the environment they sleep in, so making sure that they're sleeping on a firm, flat surface, that there's not too much bedding, the babies aren't too warm, that they're sleeping in their own safe environment. These things can all contribute hugely to reducing a baby's risk. Another main factor is whether parents are smoking, whether there's members of the household smoking, whether mum has smoked during pregnancy, because these babies will be more vulnerable. So again, it's about sharing the messages that smoking plays a big factor in the number of babies that die from cot death. And I think as well things like promoting breastfeeding. We know that that's protective, so if babies can be breastfed, we can't say it will reduce every risk, we know it will reduce the risk a little bit, and that goes some way towards it. The difference I think with the Scottish Cot Death Trust is this is what we are dedicated to doing. We are solely focused on sudden and unexpected deaths, and anyone who works with this organisation or on behalf of this organisation. So we employ services of regional support workers. We might refer families for specific counselling if there's certain issues that they're really struggling with in their bereavement. We would look to get some psychotherapy to help them through that, to help their recovery. It might be that siblings are needing some play therapy if they've been really traumatised by what happened when their baby brother or sister was found. Anyone working for us has had training to understand the whole medical legal process that has to happen after a sudden unexpected death in infancy. And part of what we do is constantly trying to educate people that the police have to be involved and will be involved in every single case. There will be a full investigation, there has to be a post-mortem. But parents are very distressed if they're constantly having to explain that to people and almost having to explain why that has happened to them. And it's not them individually, it happens to every single family when there is a sudden unexpected death. So anyone that works for us has a complete understanding of that process, and that, I think, makes us different from when families perhaps engage with generic bereavement services and find that it really hasn't met their needs, because there's that lack of understanding about the Scottish legal process. We rely very heavily on public donations. A lot of the donations that we receive are from families who are doing fundraising events in memory of their child who's died. And that, I guess, to a lot of people would make sense. It's people that we have supported that then support us. But we do rely on charitable funding from other trusts and organisations. We do get some funding from Scottish Government, but it is minimal, and year on year that funding is being cut. So we rely on around 89% of our funding from public donations, and that's getting harder and harder to come by. But we strive to keep the same services. We have never cut the services that we provide to families. And indeed, to date, we've funded around 3.2 million on research into the causes. So I think, as a very small organisation, we're quite proud of what we can achieve. But it's challenging, and it's challenging every day to be constantly seeking funding to continue our work. I think most people would be very surprised to learn that we're such a small organisation. We have 2 full-time members of staff and 3 part-time members of staff. We're based in one office within Glasgow, but we do cover the whole of Scotland, and for us it doesn't matter where a family live, it doesn't matter where a group of professionals that need education are, we provide that service, whether they are in the north of the Highlands, whether they're in Dumfries and Galloway. Everybody is offered the same service, free of charge, from this organisation. We last year had around 107 referrals into the organisation. We were able to provide a bespoke service to any family member. And I think that's a strength of this organisation, that we can very much provide what an individual needs. We're not having to be too prescriptive. We delivered education to around 2,500 professionals across Scotland, whether they were midwives, health visitors, police. And again, I don't think people often realise the impact and reach that this charity has. I think we do punch well above our weight.